felt like could be very educational for people to hear your perspective.
Well, I appreciate you continuing to talk about COVID because I think a lot of people are sick of it. I'm certainly ready to move on. But
I am too, but
God.
It's just people need to make sure this doesn't happen again.
Exactly.
You know?
And nothing's happened, really. Nothing's been corrected.
No. Not only has nothing been corrected, I was just watching an argument on television where they were trying to argue for vaccinating women who are pregnant.
Oh, right.
It's
It's insane. I mean, there's a golden rule of pregnancy, right? You don't experiment on pregnant women. You don't experiment on an unborn child.
You're not even supposed to eat sushi.
Exactly, right. But we're going to put this modified mRNA technology into these women who, early treatment. We have early treatment. COVID is no longer a threat. We're dealing, at one point it was more than a cold, but not now. Why in the world would we give them to pregnant women or children?
The only thing that makes sense is money.
Right. Well,
It's the only thing that makes sense.
Ego, and
Ego, meaning because they've already recommended it, because they don't want to admit that it's not effective. They don't want to admit their side effects.
I mean, we have hard facts showing it should be pulled off the market. I mean, any other product would have been pulled a long time ago. If this were an antibiotic and we'd seen all the carnage from an antibiotic, it would have been yanked off long ago. It should have been yanked off in the first month. There's no other explanation than there's fraud, there's corruption, there's ego, there's money. But it's not science.
No, and there's a lot of people that, for whatever reason, they have this very rigid ideology that the pharmaceutical drug companies are to be trusted, and we should trust the science, and that all these organizations, whether it's the FDA or whatever it is that's connected to these assertions, they should be trusted, not just the average doctor who's talking about these side effects and all these different things that they're experiencing with their patients.
Yeah, I mean, I trusted them when the pandemic started. I mean, I didn't think that the shots would work necessarily, but I trusted them. I didn't think they were going to hurt us.
Why didn't you think they would work?
Because they were rushed to the market. I knew the flu shots were already iffy. We're dealing with a virus that mutates. We've never been able to vaccinate against a cold, which, it's a rapidly mutating virus. It's been tried before, and it's failed.
But if you don't mind, please tell everybody what your background is in medicine.
I'm private practice, solo physician. I'm not head of the Mayo Clinic. I'm just a, neighborhood ear, nose, and throat doctor that sort of got tangled up in this inadvertently. And I always thought when the pandemic started, I thought, well, this will be the hospital. This will be a chaos in the hospitals. I never envisioned getting wrapped up in this at all. I trained at Stanford, and then I moved to Texas after residency. And then I worked in a small private practice for 7-8 years. Then I started having a bunch of children, and I pretty much gave up medicine. I mean, I took a 7-year sabbatical. I wasn't even sure I was going to go back, but then I just had this itch that needed to be scratched, and I opened up a solo practice 6 months before the pandemic started.
Oh, boy.
Yeah.
What timing.
I know. Why? Why did I do it?
You could have been out.
I know.
Yeah, well, sometimes the universe has a calling for people,
It's been a very interesting journey. I mean,
so take us through what happened with you at the very beginning. So COVID starts making its way across the world.
Yeah, so I had people coming in with respiratory tract infections that were stubborn. They were not, the typical colds. And there was all this, news that there's this virus from China. But, you watch something on the news, you think, oh, that's not going to really affect me. But, I started having more and more patients coming in. And at first, I really didn't know what to do. I just used common sense. I mean, I treated the symptoms. I used breathing treatments. I covered for secondary infection with antibiotics. I used steroids, that sort of thing. And I had success, but I didn't have a lot of people, showing up at my doorstep, treat me for COVID. But I did start having people wanting to get tested. And you might remember that LabCorp was the first lab in the country to offer the test. And they just got completely slammed. So it took 2 weeks to get the results back. I was already working with a lab for patients with chronic sinusitis who they were doing PCR testing for chronic sinusitis. So it tests for bacterial and fungal infections of the sinuses. It's called Microgen DX. And they came out with a saliva test for COVID. So, and we were able to get the results back the next day. So I started offering that, and my little clinic exploded and I'm located in a strip mall, which is very purposeful. I'm very close to the medical center, which is, to get your doctor's office, it's a 10-minute navigation of the parking garage, and another 10-minute walk to the office. And so I was trying to locate my office where it was very easy to get in and out of. And then that served me very well during the pandemic, because with these saliva tests, you could just take the cup to somebody's car. They could spit in the cup. They could leave it outside. It was contact-free. You didn't have to have anything shoved up your nose. And then we got the results back the next day. And so that sort of put me on the map in my little neighborhood. And then I started tracking, when the vaccines came out, I started tracking who was positive, by their vaccination status. And so I started noticing that the vaccine wasn't working. And that's sort of what got me in trouble. I also started giving monoclonal antibodies, and I didn't ration them. So I became known in town as a place you could get monoclonal antibodies without, having to pass, being a certain race or a certain age or that sort of thing.
What do you think that was all about?
Yeah, I don't know. But the monoclonal antibodies is very frustrating to me. They worked very well. They were not controversial. People would turn around the next day. But when they first came out, I could get as many doses as I wanted. I mean, they show up at my doorstep the next day. And it was great. I mean, that also sort of put me on the map with COVID. And then I didn't even use ivermectin until the government took over distribution of monoclonal antibodies. And then it became harder and harder to get them. And that's when I turned to ivermectin. But, in my opinion, they did that on purpose. They did that to encourage people to take the COVID shot. It was very orchestrated. If you look at the timing, in March, the government put out the big information on ivermectin and why you should not take it for COVID. They put that on the FDA's website. At the same time, they launched COVID-19 Community Core, and this was April 1st, 2021. This was an $11.5 billion slush fund to feed out propaganda and censor people. And the day that they launched the COVID-19 Community Core was the same day that Houston Methodist, which is where I had privileges, they mandated the COVID shots for all their employees. And they were the first in the country. And that's sort of how I got tangled up in all this, because I had privileges there. And then I was actually working with them. I was doing research with them. I was sharing my data with them to try to get it published. But then I started questioning the vaccine and how it wasn't working. I brought it to their attention first, and they gaslit me. They just said, well, it lowers severity. And when they ignored me, then I started speaking out on social media, and that's what got me in trouble. But so that summer, 2021, that's when the third and the largest surge of the pandemic started. And this was after the rollout of the wonderful COVID shots that were promised to stop transmission and prevent death, and obviously didn't. And the government was getting frustrated. So they doubled down on their ivermectin attack, and this was end of August 2021. They put out the infamous horse tweet. Said, seriously, y'all, you're not a horse, you're not a cow, stop it. A tweet went viral. It had dire consequences, in my opinion. And then they fully approved the COVID shot. And then Biden mandated for employers with 100 more employees. And that was right when they took you down. So It was all very coordinated. Oh, and then the final straw was taking away monoclonal antibodies. They said that. So.
Yeah, that was the more fascinating thing about it to me is I listed a bunch of different things that I took, including monoclonal antibodies, but they only concentrated on ivermectin.
Mm-hmm.
But the way they did it was like so transparent, like changing the color of my face on CNN and everywhere, this concerted effort to call it horse dewormer. They just tried to make it look as preposterous as possible without ever explaining that it's been used more than multiple billions of times prescribed to human beings.
Yeah, I mean, they branded you. When I think of you, I think of that picture of you where you're slightly green. And I honestly, but ivermectin, I was nervous about using it because of all the hype, and because monoclonals worked so well. I was like, well, this is not going to this is not going to work. I was nervous. But the first thing I did was dug into the safety, and anybody could do that, which is a minimal amount of effort. You can go to the FDA website and you can find the toxicity data on ivermectin. And there's something called the LD50, lethal dose 50, which is it's a benchmark number that gives you an idea of how toxic a medication is. And LD50 means how many what dose would kill 50% of lab animals. So for ivermectin, it kind of depends on the type of animal and the gender. But it's basically 10 milligrams per kilogram up to 80 milligrams per kilogram. So for COVID, we're using 0.4 milligrams per kilogram. So I knew that we were not worried about killing people with it. And then I did a literature search, and I looked for accidental, intentional overdoses for ivermectin, and I couldn't find a single study. Whereas you do that for Tylenol, thousands of reports. So once I knew it was safe, then I started using it, and then I found it worked. And then, all in all, I treated well over 6,000 patients, and everybody that got early treatment stayed out of the hospital. I also had patients come in that were really sick in the second week, and that was such a learning experience for me because normally if somebody walked into my office with an oxygen saturation in the low 80s, I would call an ambulance. But I had patients who would refusing to go to the hospital, and I had to give them the option to possibly die in my office, which is scary. But we saved them. We just threw the kitchen sink at them, and we didn't have monoclonal antibodies. So we brought them in every day. We did IV steroids. We did IV antibiotics. We gave them home oxygen. We gave them high dose of ivermectin. We did everything we could, and it was amazing. They survived. It was very gratifying.
So you think it was probably a combination of all the different medications and all the different treatments?
I would vary my approach depending on the severity, the comorbidities. It's an art, not a protocol.
Right.
Is a guideline, right? But every patient is sort of individual. And so for the patients, the one patient I'm thinking of, he had a history of 2 heart attacks. He had a history of throat cancer.
Oof.
He came in with an oxygen level, it was below 80. I can't remember exactly what it was. But so I just did everything. I took everything that I could and gave it to him, and it worked. And I had a few people like that. But if a 20-year-old came in, I'd probably just give him some ivermectin, and it just depends.
Why did you decide to try ivermectin, even though there was all this negative propaganda?
Well, because I had patients coming to see me who needed help. I just wasn't going to shut my door. I'd already established I could help people with monoclonal antibodies, so I still had people coming to me seeking help, and I just didn't have the heart to say no, and I knew it was safe. So I knew that it was a little bit iffy, but I knew it was safe, and there was good data showing it worked. It's just, one thing, you can find a study to support any argument you want in medicine. I learned that in residency. All residents learn that. We have something called Journal Club where you sit down once a week and you pour through different articles, and the takeaway is most articles are, crap. They're low power, or they're conflicts of interest, or they're designed poorly. So, my mindset coming into the pandemic was, the research, the journals are a starting point, but it's not the final say is your own clinical experience and what you're seeing. And we had never seen COVID before. This is a brand new entity, so we were learning on the fly. But I've never treated this many patients with a single disease in my career. I'm sure I never will again. And so you quickly become an expert. And, I can't speak for all doctors, but we like to do well. We like our patients to get better. It's gratifying. That's how you get job satisfaction, is seeing your patients do well. So why would I, continue to have, COVID patients come in if I couldn't help them? And it's astounding to me that the doctors in the hospitals just didn't pivot, didn't try new things. And I guess they were handcuffed by, the hospital administrators. But it just seems to me that, there was a doctor in Houston, Joe Rogan, who I'm pretty good friends with, who is a critical care doctor, and he was one of the founders of FLCCC, which is sort of they developed the original protocols for ivermectin. And Dr. Verone had much better success than most other doctors. His overall success rate was 4.4% of his patients died, whereas in other hospitals, it averaged around 20%. And he threw the kitchen sink at people, and he basically followed this FLCCC hospital protocol.
So when the monoclonal antibodies were suppressed, what was the messaging? Like, what did they say to doctors?
They said that the strain of the virus was no longer covered, so that it had evolved and it wouldn't work. But
at the same time, they're using the exact same vaccine.
Exactly. And they had switched the monoclonal antibodies periodically. So it wasn't like they started with one and stuck with it the whole time. They switched it as things evolved. But
it was really clear. And the propaganda was shocking because we've all seen propaganda with foreign conflicts, weapons of mass destruction, all that jazz. We've all seen propaganda. But when Rolling Stone magazine printed an article saying that the hospitals were overflowing with people overdosing on ivermectin and gunshot victims couldn't get in, and then they used a stock photo, which was of a bunch of people wearing winter coats in I think the article was August in Oklahoma. Like the whole thing was so brazen and sloppy and obvious, especially in the age of Google. If this had all gone down in the 1980s, we would all be in the dark. We would have no idea. We would have been like, wow, I guess the ivermectin's killing people. We wouldn't have known until like 2030. People would have you have been a conspiracy theorist. You've been a crazy person, like one of those people that could tell you all the facts about the Kennedy assassination, with wild eyes. Oliver Stone. But it was so obvious and it was so confusing because, I had people on my podcast before where, I had doctors on and I would talk about foolish people that don't believe in traditional medicine, like people that want to try different things. Like, are you crazy? People that were anti-vaccine or anti-anything. I'm like, these are the best people at the front of the line. Trust them. 5 years later, I'm like, don't trust anybody. They're all compromised. It's all money. And that was the most disheartening thing. The propaganda was disheartening, but it was that the whole system is compromised. And then when I found out that pharmaceutical drug companies they're the ones that are funding studies and that they could have a whole ton of studies. They don't have to divulge all the data from their studies. They only have to show you some studies that were carefully crafted to show efficacy. But all the other studies that they had that even showed negative effects, they could bury those. They weren't held responsible.
Exactly.
I was like, what is this? Like, what is this? It's like everything in the world when money gets involved.
That Rolling Stone tweet is still up. I found it yesterday.
So
couldn't believe it.
Wild. Look at that. Look at these people wearing winter coats.
Yeah.
So apparently this was a bunch of people that were waiting in line for the flu shot. Gunshot victims. All those people got shot. What the fuck is going on in Oklahoma? They're just shooting folks. They think it's the Wild West out there. Imagine if those were all gunshot. But look how crazy that article is, or that tweet is. Gunshot victims left waiting as horse dewormer overdoses overwhelm Oklahoma. By the way, 0 horse dewormers there. 0.
Well,
it was a total lie.
Well, and even last Friday, Vanity Fair did an article on Maha and Cali Means, and they quoted me in it. And in their description of me, they used horse dewormer. I could not believe it. Catherine Ebon, the reporter for Vanity Fair, and she buddied up to me, acted like we were good friends.
That's how they always do it.
Yep.
This episode is brought to you by BetterHelp. Sometimes it can feel like you're carrying the weight of the world on your shoulders. And for guys, especially, it can feel like you have to carry that burden on your own. There's a lot of stigma around men being the provider, to keep it all together by themselves. But that's not good for you, your family, or anyone. Did you know that 6 million men suffer from depression every year in the U.S.? And it often goes undiagnosed because of these stigmas. Real strength isn't bottling things up inside, though. It's admitting to your faults and doing something to better yourself. So go talk to someone, a friend, your partner, family, a therapist. Therapy is an excellent tool everyone should utilize. It's a great way to learn more positive coping skills, like how to manage stress, and help you live a more balanced and fulfilling life. BetterHelp is a great place to start that conversation, judging by the millions of reviews and the 4.9 rating in the App Store. It's helped many people across the globe. As the largest online therapy provider in the world, BetterHelp can provide access to mental health professionals with a diverse variety of expertise. Talk it out with BetterHelp. Our listeners get 10% off their first month at betterhelp.com/JRE. That's betterhelp.com/JRE. They're all
I learned
dirty.
a valuable lesson.
It's so dirty. It's such a dirty business. God, I used to have massive respect for journalists.
No.
If I had never done this podcast, I'd be your regular schmo out there with, just spitting out all the company lines that all the blast all over the news. I kind of liked it better then.
It was a lot easier, right? Ignorance is bliss.
I didn't think the world was filled with demons, money-hungry demons that are willing to sacrifice human lives in the pursuit of revenue. It's crazy.
That's why we have to continue this fight, because people have lost all trust with good reason.
With good reason. That's why I'm having you on. That's why I continue to talk. People are like, stop with the COVID already. I get it, folks. If this is not for you, move on. Mary and I will still be bitching about this for the next 3 years.
Right.
Well, for me, it was such a wake-up call, because it's so weird to see your face on TV green, first of all. That was weird. And then this term horse dewormer. I'm like, why you guys aren't concentrating on the fact that a 55-year-old man is fine 3 days later during the worst strain? It was during the Delta, where everybody's freaking out. This one's going to kill us all. And I was fine in 3 days. And I made this video. I'm like, I'm sorry, I have to cancel the concert this weekend. I got COVID, but I'm good now. And then I didn't think that was going to be anything. I thought that was just going to be the people that bought tickets to see Dave Chappelle and I in New Orleans. And that was was it Nashville? Wherever it was. That's all it was going to be. Those folks are going to be upset. I'm sorry. We'll make it up to you. Your tickets still count. That's all I thought it was going to be. I thought it was going to be like a normal tweet that I put out, or a normal Instagram post that I put out. And then all of a sudden, I hear that Neil Young wants me removed from Spotify. I was like, what the fuck is going on? This is crazy. Spotify got calls from 2 former presidents.
Really?
Oh, yeah.
What about?
Oh, yeah.
Did they deplatform? Did you get censored or deplatformed?
No, I grew by 2 million subscribers in a month.
Right.
I did. Because people started listening, because they made it sound like I was this maniac. And they started listening, like, oh, he's really reasonable and pretty humble about all this stuff, just asking questions and bringing people on, like Dr. Robert Malone, who has 9 patents in the invention of mRNA vaccine technology. Like, he's one of he took it himself.
Yeah. He
was reporting his insane adverse side effect where he almost died. He was telling about it, and they labeled him a kook for that.
What made you so awake, though?
Well, that.
Just Malone?
That. No, Malone, Peter McCullough. But I've always been the type of person that is like, if someone is saying something and they have rock solid connect. Dr. Peter McCullough is the most published physician in his field in human history. Like, this is a incredibly well-respected doctor up until he took a moral and ethical stand saying that this is not what they're saying, this is not what we should be doing, and then destroyed. Yep. They tried to destroy his career.
He's had a horrible...
It's insane. Yeah. But the man has incredible courage, and he was labeled when I would tell people he's the most published physician in time, you'd see their eyes glaze over, like they didn't want to hear it. Mm-hmm. I'm like, maybe he's right. Well, 5 years later, we know he's right. Mm-hmm. We know he was right. He was right all along. I mean, the whole... So for me, when there's always a bunch of people that are ideologically or financially captured. And then there's people that feel morally obligated to tell the truth. And you can spot those people. And when I spotted a few of them, I'm like, okay, let me hear them out. I might be the guy that goes, no, this guy's a kook and he's going to cost people lives. Or I might be someone who go, hey, everybody, hit the brakes. Right. Like, you might be getting bamboozled here. And especially the real concern with any sort of a new drug is always the side effects. But when you have indemnity, when you have complete immunity for any financial liability, like the vaccine manufacturers do, and all you have to do is label it a vaccine.
Right.
Because that's not a traditional vaccine. It's just not. They changed the definition for mRNA vaccine technology. Before that, it was not that. It was a very different thing. We all had in our head, vaccines are good. That's why they don't get sued, because we need vaccines. Mm-hmm. And then, unfortunately, I read Robert F. Kennedy Jr.'s book, The Real Anthony Fauci. I was like, oh, my God.
What was your initial thought about the COVID shot? What was your mindset?
I was ready to take it.
Did you take it?
No, I didn't take it, but that's why they were so mad at me. I was ready to take it. The UFC had allocated shots for all the Johnson & Johnson for all their employees. And I showed up there on a Saturday, which was the day of the fights. And I said, can you give it to me? And they said, yeah, sure. Let's call the doctor. We'll set it up. I thought I was going to get a shot. I thought it was like a flu shot. Like, I'll get that shot and I'll go do the broadcast. I was going to do the broadcast. I didn't think anything of it. I was not worried about it at all. And they said, no, you have to come to the clinic and do it. Could you do that on Monday? And I said, I can't, but I'll be back in 2 weeks. During the time that I was trying to get it, and then in 2 weeks later when the next fights were, it got pulled from the market because of blood clots. And then 2 people I knew had strokes. Mm-hmm. And I was like, hold the fuck up. Yep. And then I got real nervous because there was a lot of family members that were like really pushing it. You need to get vaccinated. Everyone should get vaccinated. Have you gotten vaccinated? Get vaccinated. We all need to do our part. We all need to get vaccinated. And then I became a heretic. Right?
Right.
Then I was like, okay, I don't think I want to do. And I had a bunch of friends that had horrible side effects, including one of them who is a young guy who has a pacemaker now.
Yep. Yep.
His heart stopped beating for like 9 seconds at a time, and he would black out. It was wild shit was happening, and I was like, I don't understand why this isn't on the news. I don't understand. And then I'm like, oh my God, I'm the news. I'm like, I have to be the news.
Yeah.
I don't want to be the news. I like talking shit. I like having a bunch of comedians here. We have laughs. We get silly. Have a few drinks, watch some funny videos, crack each other, have fun. Or scientists. I like to have fascinating people in here. Tell me how the cosmos was formed. I don't want to be someone who distributes information to the masses that's been lied to. That's not. I don't have any lofty goals like that. Like I want to be the one who tells the truth, and that's not what I do.
No.
I'm just a curious person who talks to people.
Was it hard for you to get ivermectin?
No, I got it from India like that. I got boxes of it. I was handing it out to everybody. I think we still have some
Most people don't have to go to
here.
India to get their medicine though,
I
in
know.
the U.S.
Well, that was after my doctor got it for me. My doctor got it for me. I think I fucked it up for everybody. I think me becoming the attack boy when they went after me, I don't think they would have attacked anybody that didn't have a large platform like that. And I don't think they would, I should say it better, I don't think they would have attacked ivermectin the way they did. I think they would have just suppressed it, and it wouldn't have been a public thing because it wouldn't have got out. But I think the problem was me saying that. The crazy thing is, I said all that other stuff too. I said IV vitamins. I said Z-Pak, prednisone. I told them all the things my doctor put me on. And all they concentrated on was this ivermectin thing. I was like, this is wild. Like, what is going on?
Yeah.
And then I was like, am I wrong about ivermectin? Like, and then I started just reading about the scientists and the team that invented it and how they won a Nobel Prize. I'm like, okay, what the hell is happening? Like, this is nuts. This is so weird.
Well, it was all part of the, getting the shot in every arm. And they had to go after ivermectin. I mean, they launched a war on ivermectin. Pierre Corey wrote a book about it.
Yes. I had Pierre on early on, too.
Yeah. And I actually sued the FDA over that horse tweet, and we won. It hasn't really changed anything, but so the FDA, when they put that information or misinformation out against ivermectin, they were really crossing a line because they're not allowed to tell the public you can't take a medication for this or you should take a medication for that. They're basically allowed to just approve medications and move on. I mean, they can issue a safety alert if there's something that comes up, but they're not allowed to really direct patients, and that's what they did. And so we did sue them, and we won, and they had to take down the horse tweet, and they had to take down the misinformation on their website. But unfortunately, as evidenced by what just happened on Vanity Fair, I mean, the brand of it being only for animals still lives on. And, it'd be great.
What happened at Vanity Fair?
So the reporter still used the term horse dewormer.
With the recent article,
right.
Yeah. Wild.
Right.
Wild. You're still being labeled a horse dewormer pusher in 2025.
Right.
When Chris Cuomo is out there talking about how he's taking it for long COVID.
Right. But it'd be great if the FDA could issue some sort of statement, saying that it is safe, that it is used in humans. They don't have to say much more than that, but we could use a little help in rebranding ivermectin. And there are also a bunch of states that are trying to make it over the counter. I'm not sure if you've seen that.
Yes, I have.
17 states have had bills in the last legislative session trying to get ivermectin over the counter. 3 have been successful, so Tennessee, Idaho, and Arkansas. 4 is still in deliberations, and 10 they failed. But another thing the FDA, I believe, should do is make ivermectin over the counter, because people are basically going to the feed store. I mean, my own kid, he had some sort of scabies situation in West Texas over the weekend. He had to go to the feed store to get treatment. And I did a poll on Twitter. 52% of the respondents said they go to the feed store to get their ivermectin. I mean,
is there any difference in the ivermectin from the feed store?
I don't know. I mean, I haven't heard of anybody having issues, but it's just unnecessary. This is America.
It's
we should be able to get the medication very easily.
And there is some sort of an efficacy for some sort of skin infections. Is that true?
Scabies is one of them.
Yeah. So, but you use it topically? Is that how it's used?
You can. I mean, for scabies, actually, you can take it orally.
Okay.
But yeah, so we shouldn't have to go to India. We shouldn't have to go to the feed store. We should be able to just go to, I mean, in Mexico,
the guy from India, he still emails me. Do you need any more, my friend?
I don't know. That kind of worries me because
I just bought boxes. I was handing out boxes to people because so many people were telling me they couldn't get it.
Right.
And so I'm like, let me just get a lot of it while I still can.
Yeah. I mean, I guess it's probably fine, but it's just unnecessary.
People are giving it to me at shows.
Oh, they were as gifts. I carry it around my purse. I'll like
Do you
be
really?
rummaging for something. Oh, here's my ivermectin. It's
Oh, I
just-
know people that take it as a prophylactic all the time.
Oh, yeah, yeah,
Which
yeah.
is so. It's just what a weird drug to go after that was on the World Health Organization's list of essential medicines.
Yeah, yeah.
I mean, how many people who had yellow fever and all the river blindness, all sorts of different parasitic infections.
It won a Nobel Prize.
And it showed that it stopped viral replication in vitro. Like
Yeah,
they
yeah.
knew that.
Yeah.
I remember when I brought that up to Sanjay Gupta, it was like, but you know it does, right? And you can see the look on his face where it's like he couldn't talk about that.
No.
He had to skirt around it and just do his best to. But it was like, this is kind of crazy to make an off-label medication so taboo.
Yeah.
And then to stop monoclonal antibodies, just stop them. Well, you couldn't
It's
get
criminal.
them. My friend, one of his buddies was in the hospital, and because he was in the hospital, they wouldn't give him
Oh,
monoclonal antibodies.
Oh yeah. If
Like,
you cross that threshold, you are not going to get monoclonal antibodies.
what is that about? Does that make any sense
Well,
to you?
they did it by the day. Apparently, there was some data showing if you gave it too late in the time course, it actually makes things worse.
How many
which I
people
don't-
did they give it to that were too late? I mean, how do we know this? Doesn't it
It's a
seem
little
like-
suspicious.
It does seem suspicious because, like, why would if you've shown something to be very effective done early on, wouldn't you assume it would continue to be at least somewhat effective?
Right.
Now, if you're trying to stop someone who's on the brink of death, which
Right.
this gentleman might wind up dying, and they didn't get it to him, if you're just trying to stop, and you can't do it because you're in the hospital because you're admitted.
Yeah.
Like, you should have like crazy data that shows like after 14 your feet fall off. 14 days of infection, your feet
Exactly.
fall off, you go blind if you take it,
Well,
can't give it to you.
And my theory is they probably had a massive inflammatory response because we would see that people would get the monoclonal antibodies and they would just feel like complete hell that night because it was like a little war going on in the body.
Right.
And then they would wake up the next day feeling great. I don't know if
Right.
you had that experience, but
Yeah, I pretty much did.
So the second week of illness was the massive inflammatory response. So my thinking is the monoclonal antibodies may have just exacerbated that, but they could have counteracted that with high dose steroids. And that was another thing. They gave these like piddly doses of steroids in the hospital.
And what steroids in particular?
Methylprednisolone or solumedrol was what we typically used if we were in.
Is
if
that
it was in the
prednisone?
hospital.
What I took? Is that the same thing?
No, well, prednisone's an oral. There are different types, but like I usually do a Medrol dose pack rather than prednisone because it's been shown to help better with respiratory. It's not a huge deal, but in the hospitals they could give solumedrol and high doses of that, but they were giving very small doses of steroid, which was a problem.
Interesting. Well, that's also one of the things that they talked about in the RFK Jr. book was that the studies that were saying that it was ineffective, the studies were not using the protocol that these doctors were using. And it seemed like these studies were designed to fail.
Exactly. And, like I said, you can find a study to support or go against anything you want, basically. So I just relied on my clinical experience. And I just had so many people saying, wow, it really made a big difference. And I saw people staying out of the hospital and it wasn't hurting anybody. So, but yeah, a lot of those studies were basically designed to fail. Either, the dose wasn't high enough or they gave it too late or it was heavily funded by somebody that doesn't want it to succeed.
Yeah, it's all very bizarre. Like, really, it's really bizarre to live through. And for you as a person who was out of medicine and then said, jump back in 6 months before all this, like, what is it like to have your worldview sort of like spun around like that?
Yeah, it's good and bad. Like, I feel sorry for the people that don't get it in a lot of ways. But I just never thought it would come to all this. I didn't go back to work to have a huge career. I was just basically trying to stay busy and active and
help people.
But I didn't envision this at all. But it's been very impactful. I'll say that.
Yeah, what has it been like having to do this, having to do all these podcasts? And,
it's wild. It's not what I envisioned at all. But it's been, I feel vindicated finally. At least I'm not embarrassed to go to the school functions anymore or show up at the sporting events. Or, I used to be scared to go to the grocery store because they came after me so hard. And in Houston, Houston Methodist Hospital is sort of the country club, the elite of the hospitals. And so for them to come after me was a big deal. It's hard to get privileges there. Their tagline is leading medicine, and they were very proud of being the first hospital in the country to mandate the shots. They didn't need to go after me. I mean, I was nothing. I was, I saw a lot of COVID patients, but in the grand scheme of things, I really wasn't, I was not really doing anything.
It's the Streisand effect, right?
Yeah,
Yeah,
exactly.
they attacked you, and by doing so, they made the whole thing way bigger than it needed to be.
But they did silence other doctors. I mean, I hear from doctors all the time that won't say anything because of what they did to me.
Yeah, no, there's a lot of doctors that I know that were in danger of losing their license because they had prescribed ivermectin.
And that was another thing. The Federation of State Medical Boards, which is this private entity, they're actually located in Texas, who oversees all the state medical boards. They sent out a directive to all the state medical boards concerning ivermectin, concerning misinformation, and basically encouraging the medical boards to go after doctors like myself. And I mean, I'm still tangled up with the medical board trying to clear my name. But they did that. It all happened in that fall of 2021, right when Biden mandated the shots. They really came down hard on the doctors.
So what did they do specifically to you?
So I got several complaints, but only one of them is really stuck. The others I've cleared my name on, but they were all involving ivermectin. No patient harm. The one that has stuck is from a hospital in Dallas called Texas Hughley Hospital, and there was this man, a sheriff's deputy, father of 6, who's basically dying. They were talking hospice, and his wife wanted him to have the opportunity to try ivermectin. And he had tried to get it before getting in the hospital and couldn't find a doctor willing to prescribe it. So wife knew he was okay with it. And so she sued the hospital, and then she asked me to come on as sort of the expert. They had to have a doctor who was willing to prescribe it, because they can't force the doctors to prescribe a medication, but they could force the hospital to give a doctor privileges who was willing to prescribe it. So that's where I came in. And we won the case, and the hospital had a court order saying that they were going to give me emergency temporary privileges so that I could go into the hospital and give him ivermectin. Well, there was all this, stall tactics. They were supposed to give me the privileges the same day. And in other circumstances at that time, because of the pandemic, they were giving doctors same-day privileges. It wasn't this lengthy application process because there was a shortage of doctors. But for me, they made me submit my surgical case log for the last 3 years. They made me get 3 letters of recommendation. They made me fill out like a 30-page application. I got it all done in 24 hours. And then they're like, no, we're actually going to deny you privileges. So it turned out into this big battle. And it became very confusing because they had to go back to the judge. And I finally got the green light, though. The lawyer's like, we can go. You've got the green light, the judge, we got the order. There's no stay on the order. I send a nurse to the hospital because this is in Dallas and I'm in Houston. Shows up with the court order, and the police greet her and turn her away. There's not a big scene. She leaves, but she's not allowed to give him ivermectin. It turns out they did get a stay, but our lawyers weren't aware of it at the time. But this is what they're going after me. They said that I sent a nurse to the hospital without privileges, and I caused a scene, and I harmed other patients by doing this. And it has been, it's 3.5 years. They can't find an expert witness to testify against me. There have been 3 continuances. They finally were awarded summary judgment against me. So they've decided I'm guilty. And now I'm waiting for my punishment. There was a hearing about a month ago to find out, what they're going to find me with and that sort of thing. And I'm just waiting on that. But I do plan on appealing. It's just gotten crazy.
Wow. So the first thing they attacked you with was what? What was the first one?
For the medical board?
Yes.
I had one pharmacist turn me in because we sort of got in a pissing match on the phone. And then
this is in 2021?
That might have been, I can't remember, but around that time. I had a father reach out to me, a 17-year-old, had a history of a kidney transplant. And they were going to Europe, and they wanted to have ivermectin just in case he got sick. And I was talking to the dad and the stepmother. I didn't realize I wasn't talking to the mother. So the mother found out I prescribed him ivermectin and turned me in. But ivermectin is metabolized by the liver, not the kidney. So it would be no harm for him to get, as having had a kidney transplant, for him to get ivermectin. And he never took the medicine. But it cost me $16,000 in legal fees to get that straightened out.
So this was your first experience, like, oh my God, like this is a real battle.
Yeah. I've never been in any trouble. I've never been sued.
Would it feel weird publicly yet? Like Like when you were saying you were having a hard time going to the grocery store, you're worried
That was when Methodists came after me. So Methodists,
they came after you very publicly.
yeah, they tweeted about me. They went to I found out that my privileges were suspended from a text message from a reporter. That's how I found out. I looked at my phone. I was like, "What are you talking about?" I did. I said, "Check your sources. I don't know what you're talking about." And then I go to my email, and they suspended me. And then they tweeted about it, and it went. I had CNN, Washington Post going after me. It was traumatic. I mean, I was just a mom of 4 with a small practice, and all of a sudden I've got CNN calling me.
Wow.
So,
what was going through your mind while that was happening?
Spent the weekend in the fetal position and a lot of tears, and then I was pissed, and I on Monday I hired a lawyer, and I hired a guy to help me with the press, and I held a press conference on Monday. I resigned, and then I sued them. So, and then I just have been working to try to clear my name.
Wow. But it's so hard to imagine for someone who's never experienced what you went through, what that must be like emotionally to just get thrown to the wolves in front of the world, like publicly, by people like CNN, like where it gets so weird because if that never happens to you, you look at CNN and you go, oh, they're the news. They're going to tell me the truth. I just automatically thought that. Or they're at least saying what they're allowed to say. Maybe the government holds back some information, but they're not going to lie. And then you see my own self on TV, and I'm sure, but I'm used to being like attacked for things.
I think the harder is CNN, whatever, but it's more just the locally, like going to the grocery store, going to the baseball game with your kids playing, and like hoping, sitting in a corner because you don't want anybody to see you.
Did anybody ever bother you?
No, honestly, no. But you just feel
Right.
very self-conscious. It's hard not to.
Yeah.
Even now, I still feel self-conscious, but it's a lot better. I mean, I had a Mother's Day event at school, and people actually came up and said nice things to me for once. So that was
nice.
That was nice.
Well, a lot of people got red-pilled,
Yeah.
to use the Matrix expression, where they woke up to what's really going on it's kind of a masterful job of propaganda over the years that the pharmaceutical drug companies have done. I mean, because most people aren't even aware of how many drugs get pulled. They're not aware of the high percentage of them. What is it, in the 30s?
Well, yes, about 33%.
Yeah.
They looked at it over 10 years. 33% had significant safety warnings on the drugs, and it took about 4 years for those to become recognized. I mean, there are drugs I used to prescribe that are no longer on the market. I mean, so yeah, like I said, it would have been any other drug would have definitely been pulled by now, based on all the adverse events we've seen.
But it's just very profitable. And that's what people have to wake up to. There's a bunch of factors, right? There's the primary one, which is a bunch of scientists that are really trying to help people. And they're really trying to develop new ways to cure Parkinson's and all sorts of other problems, and cancer, and these people are just constantly. And then there's the money people. Mm-hmm. The money people who take that thing and say, how do we give OxyContin to everybody? Mm-hmm. And then you have the Sackler family, right? You have evil. You have like actual evil. Maybe they don't have horns. Maybe they don't have a forked tail, but that's a demonic thing to do. You're infecting people with essentially something that turns them into a zombie, and it's killing people.
Especially
but you're
in
going to
health.
make a lot of money.
In health too, especially in health.
Well, it's because you're so trusted. You're coming from a position of authority. It's a very different thing, especially in an area where most people are woefully ignorant. I mean, look how many doctors who are practicing doctors who are woefully ignorant about nutrition.
Right.
It's an enormous amount, right?
Yeah.
Now imagine the average person who has to go to a specialist about something, and they're being told, oh, you need Vioxx. Mm-hmm. This is this thing I'm going to give you, and it's going to cure your arthritis. Like, oh, great. And then you fucking stroke out.
Yep.
And the people who made that drug knew it was going to cause problems in people. They in the emails that were admitted during the hearings when they lost or during the court proceedings, they wound up paying a fraction of what they made. They made like $12 billion. They had to pay. I think they had to pay $5 billion, so they made $7 billion. It's costs and stuff. Stuff costs money. But Jesus, it's so hard. It's so hard to wake up to that. It's so hard to like go, oh, wait. So they're not looking out for us? They're not like trying to make us better? I always thought they were the people that were the most wonderful people in the world. They're the people that are providing the medication that's keeping everyone alive. This is why our life expectancy is 100 years old now, as opposed to just 20 years ago. Like, oh, great.
Life expectancy has gone down, actually.
Whoops. Whoops.
Despite all the vaccines.
Yeah. Yeah.
And vaccines are even their own special class, right? It's the gospel. It's a religion. It's a gospel. I mean, it was never a question in my training. Never.
I would have never questioned it. Not only that, I would not talk to anybody who did. I'd be like, get out of here.
Right.
I'm not having an anti-vaxxer on the show. Fuck off. But after reading Suzanne Humphrey's book, and I had her on recently, reading that book, it was like, what? Wait a minute, what? And then this can't be true. And then just look at the raw data of like when the vaccines were introduced, and also when hygiene was introduced and sanitation was introduced, and then massive drop off of the disease. And then at the very end, when it's almost gone, vaccines are introduced in almost every case. And yet we all are thinking like, thank God vaccines exist, because otherwise we'd all have polio. Like, oh Christ.
Yeah, it bothers me that I never questioned it.
Never would have. The polio one blew me away when you find out that that was the same time where they were using DDT everywhere. And the people that were getting polio first were people in rural farmland communities where they sprayed DDT everywhere. And it wasn't just affecting people, it was affecting horses. And it doesn't cross species. So it wasn't the same thing. Clearly something was going on. And everybody got locked into this polio scare. And to this day, I had a friend use that to me in a text message to me. About like, look, we have to really appreciate that, he was like trying to make up for some stupid joke. And he was saying that look at Jonas Salk cure polio. I'm like, I don't have the time. I don't have the time to sit down and tell him there's a great book. It's called Dissolving Illusions. You should read it. And then you should read Turtles All the Way Down. It's another great book. And then you should listen to Robert F. Kennedy Jr.'s journey from being a very respected and trusted environmental attorney who was applauded by the left to being some nutcase pariah who I thought was a nutcase. I had to apologize to him when I had him on the show. I said, I have to tell you, when I first heard of you, and I thought you were a kook. You're this anti-vaccine kook. I was living in L.A., working in Hollywood. I bought into it, hook, line, and sinker. Everybody around me thought that way. So I thought this is what sensible, intelligent people think.
Yeah. But I don't think you can really convince people. I think they have to figure it out for themselves.
No, they don't want to hear it. That's the thing. It's like telling someone that their spaghetti monster in the sky is not real. Like they don't want to hear it.
You just can't, right? I've just given up. But but there's hope. I mean, you came around and you're not in the field, right? And people, I think, COVID directly impacted every single American, and not in a good way, right?
No, there's nothing good about it.
And
the only thing good about it was a shift in perspective.
Right.
And that it's going to be way harder to pull some shit off like this again.
Right.
People are not going to buy into it, especially all those vaccine-injured people who keep getting gaslit. Why do they keep calling it long COVID? How come nobody I know who wasn't vaccinated got long COVID?
Right.
What is this long COVID you speak of? Is there long flu? Where's the long pneumonia? What the fuck are you talking about? Why are you calling it? Is it possible that this is a vaccine injury? I'm just asking.
Well, yeah, I've been looking at antibody levels in these people, and it's alarming. So we really don't have a lot of tests for vaccine injured. It's hard because they'll get the $1 million workup. By the time they come to see me, they've gone through, multiple tests, they have multiple doctors.
It's not really $1 million, is it? The workup?
Well, I don't know, but I'm exaggerating. But
right. I just want to be clear.
I don't get it.
From some Vanity Fair came horse dewormer who claimed there was $1 million markup.
Somebody should fact check me on that, and it's probably higher than $1 million, but. So they get they go through the workup, and then they can't find a test to prove that they're injured. So the doctors will put them on psychiatric medication. They'll put them on sleeping pills and benzodiazepines and antidepressants. Literally, I saw a patient was put on all three. So the only test that I have found that does seem to correlate is this antibody test. And it's a spike protein antibody test. LabCorp has it. That's where I send people. Quest has it, but they put the upper limit as too low, so you don't really get a good sense. But the upper limit of the test is 25,000. And people that have not gotten the COVID shots, I'd say it's usually under 1,000. And then people that have gotten the shots, I mean, a lot of them are off the chart. They're over 25,000. But on average, they're probably 10 times higher than the people that have not gotten the shot. And this is people who they were vaccinated 4 years ago. It wasn't like they just got the shot. Obviously, COVID's not an issue anymore in terms of, people getting sick. But 4 years later, you should not have sky-high antibody levels. And that's what I'm seeing. And that is alarming. It just suggests that there is a lot of spike protein still in the body causing problems.
And haven't they shown that the spike protein continues to be produced in the body up to 700 days later?
Yes. I mean, that's one study. There's some, what's interesting in that study, that antibody levels were really low, which doesn't make sense. So I kind of questioned the whole study, but yeah, I mean, I see it. I mean, I see patients. I mean, I still see vaccine injured patients coming to me for the first time years later. Last week, I probably saw 6 new vaccine injured patients, and they're not getting any help. The government, it's called the CICP. It's a countermeasures injury compensation program. They're supposed to help these patients. They have denied 98% of people that have applied for assistance. They, on average, I think they've awarded 30 people, 30 of all the vaccine injured that have applied, 30 people. On average, the award is like $4,000 for these people. It's horrible. I mean, these people's lives are just destroyed. These are not easy things to treat. It's not like I can give them an antibiotic and they're good to go and they're fine. I mean, they're very challenging. We don't have a lot of guidance. I do see a lot of success with ivermectin, but it's slow going. It's usually months of trying to help them. And the government really needs to help these people because there's a lot of people suffering, and they're getting completely ignored. The other issue is we don't even have a code. So every disease has a numerical code, and it's called an ICD-10 code. It's what they use to compensate people for, or the insurance companies use them, but also for tracking. So if you have, COVID has its own little code, and you can just dial in the code and get all the numbers. They don't have a code for vaccine injury. They have a code for vaccine hesitancy, but they don't have a code for injury. So all these people are just sort of, they're getting all these diagnoses, but there's no way to track them. It's a big problem.
How convenient.
Yeah.
Well, I would imagine the real problem with paying people is you'd have to pay so many. But that's
we can just print the money. I don't know what the problem is.
I mean, what do you give them? What if you find out you have myocarditis and your life expectancy is greatly reduced, and we know for a fact it came out of this vaccine? What do you give a person like that? You're going to take
their life's wages. What wages that they would have potentially earned?
What if it's Katy Perry?
Well, so be it.
You know what I'm saying? Like, you have to give her $2 billion.
I don't care.
Like, what do you do?
The vaccine companies can pay that money.
I know, but it's insane. The number of people that I personally know. What's very shocking to me is when I talk to people that are pro-vaccine, still pro-vaccine, and when I be very specific, mRNA vaccine, still pro-COVID vaccine, that will tell me they don't know anybody who was injured by it.
Yeah.
I was like, how is that possible?
How many people do you know?
I know a lot.
Yeah.
I know 2 people on pacemakers.
Yeah.
2. And they're young people.
Everybody knows somebody.
Yeah, I know a lot of people that got fucked up, including family members. I know a lot of people that got fucked up. And people that don't want to admit they got fucked up, all of a sudden they have this new cancer that's spreading, like, rapidly.
Yep. It's
terrifying. It's like I watched the Danny Jones podcast, and you guys were trying to get Callie Means to talk about SV40. Right.
Well, my thing with Callie, I actually talked to him last night. Just why he will not go on record to state that COVID shots should be pulled off the market, and that's the whole. He's the head of.
Do you think that's being political? That's trying to appease too many people? What do you think that is?
I can't read their minds, but I think anybody with a big microphone, who is in a position of power, and who knows the truth, is ethically obligated to speak the truth. That's how I see it. I mean, I'm not a politician. I keep hearing the word strategy. But there are people I'm just faced with the carnage every day in my office. It's just, I can't ignore it. And I don't understand why this is so difficult other than, political, but it shouldn't be political.
It shouldn't be. Right. That's what's disappointing, because we thought that this administration come in and it was just going to kick down doors.
Right.
Like, this is it. Epstein list, day one. Who killed JFK? Let's find out. What are all these fucking UFOs?
That wasn't on my priority list, but yeah.
I'm a dummy. That was my number one. If I had out of those 3, give me that one. Tell me the aliens are real. But this political dance, this excuse for that. So I really appreciated Jack Cruz kind of pestering him on that. And then I've talked to Brett Weinstein about that as well. And he gave a breakdown of how it actually happened and when the original kidney cells from these monkeys were being used to make vaccines, that they inadvertently gave these people this simian virus 40, which when it gets into the human body can lead to rapid cancer.
Right. Well, yeah, that's one of the cancer-causing issues with these shots. That's not the only one, though. I mean, it goes into the cell. it's supposed to not get into the nucleus, but it could get in the nucleus. We know that it can get into the nucleus. And then if it gets in the nucleus,
Well, at first they thought it
game
was going
over.
to stay local.
Right. It's only going to stay in the arm, right?
It's going to stay right where your arm is. Your body will react to
Right.
it. It'll produce the antibodies, and then you're good to go.
Yeah.
And then all these silly people, you can watch them die in the streets and laugh as you step over them. Ha, ha, ha. I was smart.
Right.
I trusted the science.
Yeah.
Yeah. So they know that that's not true. It doesn't stay local. They know it doesn't dissipate within, it was a small amount of time that it's supposed to stay inside your body. They know that's not true.
Right. So, yeah, they replaced one of the nucleotides with something that's hard to break down, pseudouridine. They've never shown that pseudouridine is cleared from the body. There's no study showing that we can clear it. So that could be why these people have these sky-high antibody levels 4 years later, because the body might not be able to break it down.
Oh, my God. Oh, my God. That's terrifying. What could you conceive of that would help something like that? Like, what could you do that would aid the body in being able to do something like that? Is there anything theorized?
I don't know. I wish, Robert Malone would be a good person to ask, maybe.
Yeah.
Maybe
he should
something
come back
like,
on and do a victory lap anyway. That guy was torn apart.
Yeah.
They were trying so hard to make him out to seem to be a kook. And every interview he would do, he would be so reasonable, so logical, so fact-based, and so knowledgeable. And he was a kook. He was a kook. I remember some fucking guy yelled at me in Vegas. He said something about me spreading disinformation. Then he said something about that idiot Malone. I'm like, that guy.
Right. The inventor of mRNA.
Or one of them,
Right.
I mean, I don't know. I'm sure it's not like none of those things ever happen in a vacuum. I'm sure there's a ton of people working on that. But he was one of them.
Right.
He's a fucking brilliant guy. So how did they find out that it can get into the nucleus?
Well, if you look at lipid nanoparticles, and that's sort of that's what. Otherwise, if you just put mRNA into the body without the lipid nanoparticle, it would get destroyed. So they put it in the shell, the lipid nanoparticle, and there are studies showing lipid nanoparticles can cross the nuclear membrane. So there's that. Kevin McKernan is a scientist. He's on X a lot. He's done a lot of work in that, showing DNA contamination that's getting into these shots, in addition to the SV40. And
DNA contamination.
Right. So there's, and this was what Joe Latipo, the Surgeon General of Florida, he has actually called for the COVID shots to be pulled off the market. And his main argument was there is a certain amount of DNA that is allowed in any kind of these products, and we have proof that they have exceeded that threshold. So there have been studies showing that there's excess DNA in these samples, which shouldn't be there. And that's just sort of this hard line that shouldn't be crossed.
Where's this DNA coming from?
In the production process, I guess. But it's pretty cut and dry. I think that's why Dr. Latipo has chosen this argument to go by, because there's just like a hard line that you don't cross, and they have crossed that.
And what happens if you get too much DNA?
Well, it can integrate. The concern is, does it integrate into your cell DNA?
Are we going to make
mess things
like
up?
Monkey people?
No, cancer, but cancer, that's...
Right. You imagine if we made like hybrid people, they turned out to look like Neanderthals, like we injected them with something that twisted their genes back. But just the idea of manipulating your DNA is so terrifying. It's like, what?
In pregnant women, right?
Right. Integrating.
It'd be one thing if it's a 70-year-old man, but a pregnant woman who,
you hear that term?
got these...
Integrate DNA. You don't think good things. That's like immediately I'm like, what?
Right. And these things are technically gene therapy products. They're not vaccines. So,
which is a real problem with using the same term. Why not use a new term? Well, because then you wouldn't be under the umbrella of protection that vaccines currently enjoy, where they can't be, which is so crazy. It's so crazy. It's just hard to believe it's true. It really is.
It is.
And so for a person like you that just like you were saying, see the carnage every day, tell me what it's been like. Like, what is it like?
It's hard because as an ENT, I'm used to fixing people quickly. So, I get somebody with a sinus infection, get them an antibiotic, they're good to go. I get somebody with an abscess, I drain the abscess, they're good to go. It's sort of why I chose my specialty, because I like to see the results quickly. I didn't go into primary care for a reason. And so when I see the injured, it's like, it's very slow going. We don't have a lot of research. It's trial and error. These people are young, were previously young and healthy, and their lives have just been completely destroyed. I don't have a big support system of other specialists I can send them to. It's hard. I mean, I don't feel sorry for myself, but I'm just saying it's just very different from what I'm used to as a doctor. So I really hope that the government will step up and do something about this.
Yeah, that would be a nice thing, to hope to do something about it. But it would be really nice if some real research was done on what are the actual long-term effects. If everyone's looking at it from a position of we can't get sued for this is dangerous, like someone has to look at it and say, well, these are the definite effects of this vaccine, because it's too much. This is long COVID. It's too much. Oh, he got a neurological condition that was going to happen anyway. It just coincidentally happened after he took the COVID shot. Like, there's got to be some way to determine what of these ailments, like specifically, like when you were talking about that abnormal antibody levels, like.
Well, there are patterns. I mean, I definitely see the same sort of things over and over again. So it's not like,
But as you said, it doesn't have a classification.
Right. It doesn't have a code. So we need an ICD-10 code for these.
That seems kind of crazy.
Yeah. Well.
Imagine if that was the case with like herpes. Everybody would be like, hey,
yeah.
Put a damn code in there so we know what this is.
Right. But there, I see very similar constellation of symptoms. I see patients with these abnormal tremors, which, they can't stop shaking even when they're sleeping. They feel internal vibrations, or they'll have severe pain that you can't explain. You get an MRI. There's no nerve damage that you can tell. I've seen some very strange rashes, and normally, it doesn't matter what kind of rash it is. You throw a few meds at it and it will disappear. But actually, the only thing that I've found helpful is ivermectin for these strange rashes. And you see POTS where the blood pressure, that's the hardest, I think. And this is we're seeing a lot of this, where the blood pressure just drops suddenly with no stimulation, or the heart races with no provocation. That is very common and very difficult to treat.
That's a good friend of mine.
Yeah.
He says every now and then his heart will just jack up to like 180.
Yep.
And he has to sit down. And he just has to hope that this isn't the last time he breathes.
Yeah.
He just sits there. He has a heart monitor. He puts it like one of them wristwatch ones, the Garmin one. He just watches his heart jack up to like 180 beats per minute, just sitting there for no reason, not knowing if you're going to die.
Right.
Another friend of mine who was really young was a soccer player. Super healthy guy, super fit. Gets the vaccine, all of a sudden, giant heart racing in the middle of the night, like out of control, like you're running a 7-minute mile, just jacked.
Yeah, yeah.
And he wound up in the hospital twice. Nothing they could do. It all went away. It stopped. It went back to normal after a while. But now he's got this like terrible fear that he's got a fucking time bomb in his chest.
Yeah.
That out of nowhere his heart would just ramp up. And you could say like, oh, it's probably a genetic thing. He probably had it already. It's like, maybe. But this guy was super fit.
Yeah.
Super fit soccer player.
And that's the athletes, the sudden death in athletes. So it used to be 29 per year. Now it's 290 per year. Growth 10 times.
Crazy.
Dropping dead.
The rarest of rare people to drop dead in the middle of nowhere. The best athletes in the world. The people who are the healthiest in the prime of their life.
Right. And I worry about these kids because, myocarditis, the primary symptom is chest pain. But if you've got a kid who's not even speaking yet, you have no idea if they have myocarditis. And myocarditis can leave a permanent scar on the heart and then lead to a lifelong increased risk of sudden cardiac death. And we have no idea if these kids have been affected.
Yeah, and how many kids did we see drop dead of heart attacks in like high school football this year?
Right.
Like over the last 4 years, rather. It was like you'd see these articles pop up all the time. You never saw those articles. Or if you did, it was super rare, and it's some kid with a heart condition that was never diagnosed, which does happen.
Yeah, and the schools are now making kids get cleared by a doctor before doing sports, which I don't remember that when we were kids.
Wow. Yeah, they just threw us right onto the wrestling team. They didn't check shit. They didn't even see if you had a cold.
Right.
Yeah. I mean, I don't know what's better. It's probably better to screen them. They'll find those undiagnosed conditions that kids can have.
Well, I think it's in response to what's happened.
Oh,
I don't
it
know
certainly
that
is.
Yeah.
But I mean, that might be the good aspect of it.
Right.
Maybe some people will get diagnosed that didn't have any idea that they were running around with a problem, and they can fix it.
But it's hard to diagnose. Like, really, the only way you can diagnose myocarditis for sure is to do either a biopsy or a cardiac MRI, which is, most kids are not going to be put through that.
Right.
So
Jesus.
It's scary.
And what's crazy is this is all true, and yet us talking about it makes us both look like kooks. Like, we then will be labeled, for sure, someone will go out and attack us now and label us anti-vax, anti-science, kooks, and this is what's dangerous about this conversation. This is what's dangerous about what they said. And, you know, those people work for the devil.
Well, do you think you'll get censored on YouTube, this interview?
No.
You don't?
No.
Because I was just on Jimmy Dore.
Yeah,
and
you
they
got
had
censored?
to bleep out, like, a full sentence of mine.
I'm not
on
bleeping
YouTube.
out shit. I'm not bleeping out shit.
You think it'll be okay?
We'll find out. I think it's wrong if it's not okay. If it's not okay, I think YouTube is more reasonable now than they were during the pandemic. And I think they have a very difficult job managing content at scale where you're dealing with, you know, the amount of people uploading things is insanity. And they have certain things that they've tagged as being controversial because they were anti-science or misinformation, that it's still, there's like lingering ones. What was the issue that we had, Jamie? We had like an old episode where there was something in the old episode that would have violated their rules back then. It doesn't violate them now. But because the episode was uploaded back then, what happened with that?
It had like a weird, at the time, the penalty was like you had to do something, and so like they couldn't take that step away. That was kind of the issue.
But the
So we had
bottom
to go
line
through the
was
bullshit.
everything this person said was true and proven to be true now. And now it's 100% fact. So now you can say whatever you want. Like now if you say, hey, you know, it's super likely that virus leaked from a lab in China. And now you can say that.
Right,
Like back
right.
then, you would get attacked.
Well,
it would be
yeah.
crazy. You'd be called a racist. You'd be called the worst things possible if you just said, like the wonderful Jon Stewart bit that he did on Colbert Show. Did you ever see that bit?
I can't remember.
You wanna see
refresh
it?
my memory? Oh, yeah.
Let's watch it because it's really hilarious. This is like in the heart of the pandemic, you know. And Stephen Colbert was like vaccine or death, you know. He was all in on it, and so Colbert was like trying to like halt him in the middle. He's doing a bit. Jon Stewart's doing a bit. He's doing a funny bit, and Colbert tries to like cock block it. He tries to like trip him, but Jon Stewart powers through, like the comic that he is. You find it? Don't tell me it was taken down.
No, there's just two versions of it. One's 9 minutes, one's 4.
All right, give us this one. All right, this is it.
I honestly mean this. I think we owe a great debt of gratitude to science. Science has, in many ways, helped ease the suffering of this pandemic, which was more than likely caused by science. So, and that's kind of.
Hold on one second.
No. Now, listen.
It's coffee. I wouldn't do that to you. I wouldn't do that to you.
I'm all for spit takes,
but
but-
what do you mean by that? Do you mean like
Well, so
this
here's
perhaps there's a chance that this was created in a lab? There's an investigation.
A chance.
Well,
I'm-
but
so-
oh my
if
God.
there's
Evidence, I'd love to hear it.
There's a novel respiratory coronavirus overtaking Wuhan, China. What do we do? Oh, you know who we could ask? The Wuhan novel respiratory coronavirus lab. The disease is the same name as the lab. That's just a little too weird, don't you think? And then they ask the scientists, they're like, how did this, so wait a minute, you work at the Wuhan respiratory coronavirus lab. How did this happen? And they're like, a pangolin kissed a turtle. And you're like, no, the name of your lab, if you look at the name, let me see your business card. Show me your business card. Oh, I work at the coronavirus lab in Wuhan. Oh, because there's a coronavirus loose in Wuhan. How did that happen? Maybe a bat flew into the cloaca of a turkey and then it sneezed into my chili and now we all have coronavirus. Like, come on.
Wait a second.
What about this? What about this? Listen to this.
Wait a second.
All right.
John.
Oh my God. There's been an outbreak of chocolatey goodness near Hershey, Pennsylvania. What do you think happened? Like, oh, I don't know. Maybe a steam shovel made it with a cocoa bean. Or it's the chocolate factory. Maybe that's it.
That could be.
Colbert kept trying to get in the way.
That could
By
be.
the way,
Let me.
I gave them all tuberculosis.
Good. That could very well be, and Anthony Fauci and Francis Collins and NIH have said, like, it should definitely be investigated.
Don't stop with the logic and people and things. The name of the disease.
Wait a second. Wait a second.
The building.
Wait a second. But it could be possible, you could be right, it could be possible that they have the lab in Wuhan to study the novel coronavirus diseases because in Wuhan, there are a lot of novel coronavirus diseases because of the bat population
Sure, no,
there.
I understand.
It's like the same.
It's
like,
a
wait
local
a second.
specialty, and it's the only place to find bats. You won't find bats
No, but
anywhere
it's
else.
like saying
Oh
why-
wait, Austin, Texas has thousands of them that fly out of a cave every night. Every night at dusk. Is there a coronavirus, an Austin coronavirus? No, it doesn't seem to be an Austin coronavirus. The only coronavirus we have is in Wuhan, where they have a lab called, what's the lab called again, Stephen?
The Wuhan Novel Coronavirus Lab.
I believe that's the case.
And
Now,
how long have you worked for Senator Ron Johnson?
let me tell you something. Let me tell you something about Ron Johnson. This is not a conspiracy. Here's the thing about science.
You could be right. You could be right.
But this is the problem with science. Science is incredible.
This
but
is
they
it.
don't know when to stop.
Okay.
And nobody in the room with those cats.
He's going to do the other thing that we already saw.
Yeah.
The other thing we talked about, the Spanish flu, which a lot of people never heard that before either. They
Yeah.
did what? Isn't that great? That's one of the best segments ever on late night television, ever in the history.
Emperor wears no clothes, and Colbert thinks the emperor still has a fancy robe on.
Well, this is the job of comedians in society at certain times. And Jon Stewart, he held the torch.
I didn't realize he was enlightened.
Well, he's a very smart guy. He's not a bullshitter. You know, he's a very smart guy. I don't agree with him on everything, but
Has he come around on the shot?
I don't know. I haven't spoken to him. He lives in another state. But I love the guy. He's great. And
He
he's
was my
he's a very
favorite
funny
comedian,
comic.
like when I was younger.
He's a
It
great
was-
comic,
yeah.
very funny guy, and a very nice guy, and very fair and honest. You know, he's you know, like the type of person who can do that on television in the middle of the shit, which is what it was. This was like right around the same time where the government was, where they made that. Remember that release that they had? They said for the vaccinated, you've done your job, but for the unvaccinated, you're looking forward to a winter of illness and death. Severe illness and death. Severe.
It's crazy.
Severe illness and death. And this was during Omicron, which
Yeah.
statistically was a cold.
Right.
That was the one that was like had the least mortality.
Yeah.
So for him to do that during that time was very courageous. Like he had to know, but he just had to make it really funny, which he did.
Yeah.
It's so preposterous because it's so on the nose. You almost think like if that was in a movie, like that would be too, like it was a Coen Brothers movie or something. Like, oh my God, this movie's ridiculous. Like there's no way it would be named the same as the lab.
Did he get smeared for it?
I don't think he did. No, John skirted out of that. He had a show with Apple for a while, and it was really good. But then I don't want to speak out of turn here, but I do all the time, so I might as well. I think there was an issue with an episode they did on China. Is that the case? Let's see if there's like data on that or if there's a story on that. But they stopped doing that show. So he had like a Apple show. You know, because Apple TV produces a lot of shows now. They have Severance. You ever watch Severance?
No, I'm watching Righteous Gemstones now.
Oh my God, that's a good show.
That's,
Oh my God,
love it.
that is such a funny show. I didn't even hear about it until like this year. There's almost too many great shows.
I know, it's hard to keep up.
That show is fantastic. That show is so funny.
I think it's modeled after Joel Osteen.
Is it really?
That's my theory. And I pass by his church every day, so
Yeah, there's something about those guys that run the mega churches. Like, you gotta be crazy. Like, not one of them is like, oh, that guy makes sense.
Right,
That guy seems
right.
like
Characters are just
super
amazing.
reasonable,
Right.
normal human being. That's like, I like that guy. I want him as my pastor. No, it's always like some complete kook. In October, the New York Times reported that Apple canceled the comedy show ahead of its third season due to creative differences and execs' concerns over Stewart's coverage of topics such as China and AI. Okay. The China, I get it. Apple has contracts with China, right? They have cell phones made in China, and they actually have to. Did a story about that the other day. Read a story about it the other day about how the iPhone 17 is so complex that it actually has to be manufactured in China because they have the best manufacturing. So they must have some sort of a thing where you can't criticize. You're gonna fuck it all up for us. You're gonna fuck it all up for the production of our phones that we need till we make all this money, which is why we have more money than most countries.
well, I don't see how Jon Stewart would be a threat to their revenue.
I just don't think they want him criticizing, China. But the AI one is even more weird. The AI one is even more weird because it's like, don't you think we should make fun of AI? Don't you think there should be like something that scares the shit out of people enough till they wake up and recognize that this thing is coming at us like a freight train. There's no guardrails. No one knows what's going to happen. And everybody's like, full steam ahead. Toot, toot.
AI terrifies me.
It should.
It does.
Well, it's because you're intelligent. You know, I think most intelligent people are aware that this will be a change that is akin to the asteroid that hit the Yucatan. This is gonna hit in some crazy way that like redefines what it means to be a human being. And it's around the corner.
Well, yeah, and you know, Texas, they love AI. They're like put a huge amount of money into AI.
Oh, fun.
Texas.
Oh, fun.
Yeah.
Choo choo.
I know you love Texas, but
I do love it here.
It is
Yeah,
not. It
there's-
is not what you think.
No,
I need
there's
to,
a lot of
I need
things.
to wake you up on Texas.
Well, I like the fact that it was free during the time where California was not. You could do
Yeah,
whatever you wanted to.
relatively.
Relatively, right. But in my business and for what I do, like the stand-up comedy and letting people tell you what you can and can't do, I don't like that.
Right.
You know, and here they've had a more rebellious spirit in that regard.
So I think healthcare, though, is turning Texas blue.
Yeah.
We have, like, Houston is home to the largest medical center in the world, and it brings in people from all over. And I think mandates started in Texas for a reason. I think they did it here to test the waters. They knew if they could get away with it in Texas, they could get away with it anywhere.
Oh, don't make me move to Florida.
No, I don't even
Don't
think. I know.
make
I
me-
think Idaho. Florida's not any good either.
Idaho's
actually.
cold as fuck. Jamie can't live. Look at him over there. He can't survive. He got out of Ohio and he developed thin blood.
But yeah, Texas. I think it's a. We have Texas Medical Association, largest medical association in the country. They are really proponents of transgender surgery in minors. They are anti-free speech for physicians. They are pro-mandate. They've gone after me, and they have a tight control over the people in our House and state. So I just think we need to be careful. I mean, you saw it during the pandemic, and the economy of our state is dominated by health, and people don't realize that. They just think oil. But health is a huge dominating factor in our economy. And, you saw what they did to me, what they're still doing to me. You see the mandates. And I don't know if you've been following what's going on in the House, but our House is divided. So we've got the real true freedom-loving representatives, and then we have these pseudo-Republicans who do control everything, but they are basically Democrats in disguise. And I don't know, it really worries me. Idaho just passed a bill, the best medical freedom bill in the country. It eliminates all medical mandates, except for hospitals, of course, but it's the first one of its kind where medical mandates are finally outlawed. Because, I mean, you think about it, all these vaccines that we have to give our kids to go to school is actually fundamentally wrong. We should not mandate any child to get a shot to go to school. And in Europe, half the countries don't have those kind of mandates. But the United States, it's very common. All kids have to get these shots to go to school. And if you opt out, it's a big deal. And some states don't even allow exemptions. So I think it's a wake-up call. Like I never thought about the fact that I had to give my kids these shots to go to school as being an issue. But now that COVID happened, I see it as a huge issue. But Florida, Florida's been kind of behind it too. Like, they're not one of the states trying to get ivermectin over the counter. There were 9 states that tried to pass bills banning mRNA. They all failed, but Florida wasn't one of those. So Florida worries me too.
Idaho.
They have good skiing there. It's beautiful.
I don't ski. Oh. I quit skiing a few years back. My last accident. I'm like, I'm done.
Skiing. I love skiing.
Oh, it's fun. Don't get hurt. Don't get hurt. Don't get hurt. Didn't get hurt. Don't get hurt. That's how I feel every time I ski. But I've had a bunch of surgeries. That's the problem. Like I know the vulnerability of knees.
Yeah.
I've had 3 knee surgeries.
Yeah.
It's like it's rough on you, But it's fun. It's just for me, like the juice isn't worth the squeeze. There's a bunch of other stuff that's a lot more fun that doesn't come with risk of broken bones and concussions.
Yeah. I don't know. I like roller coasters for fun, but
Oh,
other than that, I
no.
can't.
You're one of those.
I'm not full on, but I don't know. Have the new roller coasters? Have you been on them recently?
Oh yeah, I have kids.
Yeah, they're much better. I mean, it's
Oh,
not what
they're
the ones we
insane.
grew up with.
No,
They're-
some of the ones like at Disneyland has some insane ones. The Incredibles ride. Have you ever
haven't
done that
done
one? Whoa!
I like Guardians of the Galaxy.
Oh, that's great.
I
that
love
one's fun. That one's really fun. Yeah, Disney. You know what's the best ride? It's in Disney World. It's an Avatar 3 virtual reality ride. It's incredible.
Is that
incredible?
Florida or California?
Florida.
Oh, yeah, I think I did that.
I think it's called Flights of Fantasy or something like that. It's incredible. Like you are one of the Avatar people, and you fly around on a dragon. And it's so good. It's so good. It just, like, you feel the breeze, you feel mist in the air. At a certain point, I'm realizing while I'm doing this, I'm like, this wasn't even remotely possible just 20 years ago.
Yeah.
Like, what is it going to look
crazy.
like 20 years from now? Like, I'm not going to have any idea. They're going to put a helmet on me. It's going to, like, sync up with my brain. Ready, brain sync. And all of a sudden, you're going to be in that world. You're like, whoa. And we're going to trust those people to let us out. You know? That's 100% coming.
Yeah, I'm happy with the roller coaster. I'll stick with that.
It's not worth it. It's not as good. You take the brain thing, get in the Avatar world.
I get sick on those rides. The ones where the 3D, I get kind of
Well,
nauseated.
this one
I'd rather-
moves too. This one you're on like a motorcycle, like a fake motorcycle, and that's to represent the dragon. You know, and you have like a handle you hold on to, and it starts moving you around. Shit. So like as you're flying, it's like it's a full sensory experience.
I think
really
I did.
Good.
I did that, and my kids made fun of me because I was screaming on it. Like
You
I was
did that
actually
one at
scared.
Disney World?
Yeah, a couple of
Yeah.
years ago. Yeah, I haven't done it since.
It's so good. Such a good ride. And that's just the tip of the iceberg. And when you connect that to AI, so it tailors something that's specific for your whatever crazy fantasy you want to do. We already have video games where people can murder people. Like that's like the most popular video game is Grand Theft Auto. And one of the things that people love about it is you could just beat some mechanic to death for no reason.
Do you think that allows people to get out their frustrations, though, in a healthier way?
Perhaps. I would recommend martial arts. I think that would be a healthier way. But I think more than anything, what it does is allows you to disassociate and just to be able to, because it doesn't mean anything. It's not really a person that's getting beat to death, but the imagery is obviously of a person that's getting beat to death. And you're able to do it with no consequences, no recourse, no bad karma. You don't even feel bad because it's a part of the game.
Yeah.
You know, what was that one where you could drag the Wild West one where you could beat people with whips? Red Dawn Redemption, is that
Dead
it?
Redemption, but-
Red Dead Redemption. Crazy games where you can do horrible things to people. Like, what is it going to be like when you have video games that are actually virtual reality, completely immersive, and you could just be a serial killer? You could be Jack the Ripper. They give you a knife, and now you're in London in the 1800s, and you're Jack the Ripper.
Why do people create these?
Because they can. Right? It's like what Jon Stewart said about the nuclear bomb. Like, why they do that? Well, and this is the same thing. This is the parallel to the Manhattan Project, because we're not the only ones that are trying to find get to the solution of what is like the ultimate expression